Good afternoon, everybody. When you look at this image, what does it make you think of? When I look at this image, it makes me think of spiritual care. Often people think that spiritual and religious care are the same, but religious care is really one aspect of spiritual care in nursing. Spiritual care is person-centered. So to help me know what spiritual care means to you, can you tell me what is important to you now? How can we help? Spiritual care can be defined as care which recognizes and responds to the human spirit when faced with life-changing events or sadness. But what does that mean in practice? As a nurse, people I know, and sometimes people I don't know, tell me about their experiences of healthcare. Like a colleague who told me about going for chemotherapy each week and being greeted by a nurse who would say, "All right then," without ever making eye contact or chatting before starting the chemotherapy treatment. It made what was already a weekly hurdle even more something to be dreaded. People also remember how it feels when their spiritual care needs are met, like a family member who was asked what was important prior to her open heart surgery. She told them she couldn't live without her morning coffee and still talks about how they brought her coffee each morning at 10 a.m. So spiritual care is about more than chaplains and quiet rooms. It's about listening and paying attention and not making assumptions about what is important to people and how they want us to help. My scoping review identified 4,000 articles in the last decade, out of which 400 were included. The analysis found that spiritual care is widely accepted as important, but that nurses don't feel confident or competent in delivering spiritual care and aren't sure they have the time or the right environment to do so. These results are similar to scoping reviews since 1995. This review was long overdue, as the last was in 2012. So how can we change the status quo? First, I will be doing an online survey with the Royal College of Nursing to update our understanding of nurses' views on spiritual care. The last survey was in 2011 and had over 4,000 responses. Then, focus groups and interviews with nurses and nursing and healthcare managers will look at whether spiritual care is a priority and how we can embed it in practice. I will also ask nurses if their perspectives on spiritual care have been changed by their experiences during the COVID-19 pandemic. The outcome of this research will be to develop a contemporary model for actioning spiritual care in nursing practice. There isn't one at present. This will support nurses, nursing managers, and nurse educators to implement systems in practice so that spiritual care becomes embedded, more a part of nursing practice than an aside to be added on if needed.